Chapter 38. Rectal Troubles. Rectal troubles are common in almost every family. Many people suffer from constipation, others, from diarrhea. Still others complain of mucus colitis griping pains in the upper and lower bowel, as well as gaseous distension, and other uncomfortable symptoms. All these, discussed in Chapter 37, are due to disturbances of function, not to any actual organic disease. The rectal outlet is known as the anus, a muscular ring which is largely under voluntary control. Under normal conditions most people have 1 or 2 well-formed bowel movements a day. They should be brown in color and free from parasites, blood, mucus, or other abnormalities. Loose, watery stools are never normal. Nor are hard, rocky stools that irritate or tear the rectal outlet. Neither constipation nor diarrhea are normal. When these occur, the cause should be diligently sought and corrected, as indicated in the preceding chapter. Painful bowel movements. Lack of sufficient fluid is a frequent cause of hard, dry stools. Neglecting the normal call of nature is another reason for trouble. These dry stools often cause severe irritation of the anorectal tissues, and this aggravates the condition. Unfortunately, many have become habituated to the use of strong laxatives, in early childhood, when they were too young to know what was happening. As a result, most of them have to suffer for the rest of their days because of this unfortunate habit pattern. Castor oil, calomel, or other strong laxatives must not be given to babies or young children. When absolutely necessary, one may occasionally need to use some mild laxatives such as milk of magnesia. Proctitis and cryptitis. This is severe inflammation of the rectal lining or mucosa. The true cause is not always known. In some cases it may be associated. 356 Rectal troubles. With ulcerative colitis. In others, it may be due to the side effects of taking certain broad-spectrum antibiotics. In still others the condition may arise from an allergy to certain foods. In this condition, a feeling of rectal discomfort is associated with repeated urges to evacuate the bowel. On attempting to do so, the patient usually passes nothing more than some gas or mucus. Occasionally all the discharge is bloody and may even contain some pus. Stools are likely to be hard and covered with mucus. In the lower bowel there may be pinpoint abscesses and superficial ulcerations that tend to aggravate the condition. Other complications, such as hemorrhoids, anal fissures, and severe itching, often present. Treatment: moist heat, either using an infrared lamp and cotton pads soaked in water, or else the use of a sitz bath 4 to 6 times a day will help to bring relief. For further instruction, see Appendix. Gentle installation of about 2 ounces of warm mineral or olive oil into the rectum will help to soften the hardened stool. This should be repeated daily as needed. Medicated suppositories containing some local healing agent should be inserted at bedtime and the first thing in the morning. Certain medications containing belladonna are often useful in quieting the irritated bowel and in reducing the amount of gas and nervous tension so often associated with this condition. Some other suitable bulk-forming medicine will help to restore the normal functions of the large bowel. The patient should take plenty fluids. In severe cases bed rest is often necessary until the pain is under control. The patient, however, should continue with sitz baths and hot applications, including hot packs to the bedroom, as shown on page 91. For the present, the diet should be of non-residue type as outlined in the appendix. The patient should not use any foods containing small seeds, such as berries, tomatoes, etc. Roughage should be avoided for the present, but later these can all be added to the diet. Anorectal abscess. This condition often follows proctitis, just described above. Inflammation within the rectum may eventually find its way to the outside, causing abscesses that discharge foul-smelling pus. Usually there is painful swelling with redness and tenderness. This is particularly fissures and hemorrhoids 357. Noticeable when walking, sitting, or having a bowel movement. Surgery is usually recommended, not only to drain the abscess, but to attempt to remove the cause. Fistula. Anorectal fistula or canal means an opening through the skin coming from the rectum to the outside. Often there are several fistulous openings at the same time. This condition seems to be more frequently associated with ulcerative colitis or regional enteritis, which are discussed elsewhere in this book. Local treatment includes the use of sitz baths as noted above. However, most of these cases require surgery before they can be completely cleared. Fissure. An anal fissure is a crack in the skin at the outlet of the rectum. This irritation usually extends down to the muscle fibers and is very painful. Anal fissures are often associated with other bowel disorders, such as chronic diarrhea or severe constipation, and also with the passage of large, hard tools. This painful disorder often causes severe spasm of the anorectal outlet. Any stretching if this area cause intense distress. The trouble is sometimes associated with syphilis, chancroid, tuberculous ulcer, and other infections conditions. Treatment: follow the suggestion for treating proctitis on page 356. If the fissure is deep, the whole area may have to be removed by surgery. Before surgery, one should have an X-ray of the entire gastrointestinal tract to be sure no other serious condition is present higher up in the bowel. Hemorrhoids or piles. Hemorrhoids or piles are due to swelling or enlargement of the veins that supply the rectal outlet of the body. This painful condition is often complicated by localized inflammation and bleeding, and also thrombosis in many cases. People who suffer from constipation and other bowel disorders are more likely to develop hemorrhoids. Hemorrhoids are also more common in pregnancy, and in conditions affecting the liver and upper bowel. 358. Rectal troubles. External hemorrhoids can be readily seen, for they actually lie outside the anorectal junction. Internal hemorrhoids are soft and dark-colored, and usually irregular in shape. When very large, they may protrude through the anus. Straining at the stool may bring them down. This may be followed by strangulation of the hemorrhoid with severe pain. Hemorrhoids are the most common cause of rectal bleeding. The blood is bright red and may be noted on the toilet paper, and also covering the surface of the stool or dripping into the toilet bowl after the stool is passed. However, because cancer of the rectum may possibly also be present, a thorough examination should be done in all cases of hemorrhoids. One should never be satisfied to consider hemorrhoids as the correct diagnosis until all other causes of rectal bleeding have been ruled out. Treatment: small hemorrhoids that cause only sight bleeding may not require any treatment beyond making sure there is nothing more serious. Try using stool softening medications, such as metamucil methylcellulose tablets, or hydrophilic psyllium muciloid, 2 teaspoons a day in a glass of water. The patient should take at least 6 to 8 glasses of water a day. The diet should be rich in fruits and vegetables. He should avoid straining at the stool. In cleaning after a bowel movement, it is better to pat the area with soft, slightly damp toilet tissue or wash gently with water and pat dry with a soft cloth or soft toilet tissue. In more complicated cases, surgery should be done. Thrombosed hemorrhoids can be removed under local anesthetic, if they are located on the outside. But internal hemorrhoids require general anesthesia. The patient should be hospitalized and well prepared before surgery is attempted. Most doctors advise against injection treatment because of the danger of complications. Following surgery, the patient should have 4 to 6 warm sitz baths a day, and also bed rest as long as may be needed for complete healing. Rectal prolapse. This is a more serious condition in which a portion of the rectum protrudes through the anal ring. It most often occurs in cases of straining at the stool. The condition can be prevented by developing proper bowel training habits and keeping the stool soft and well. Rectal injuries 359. Formed. Any condition such as hemorrhoids or rectal polyps should be properly treated. Surgery is usually advisable in all cases of rectal prolapse. Rectal injuries. Although the rectal area is fairly well protected, Injuries are sometimes caused by kicks, falls, fractures, and insertion of foreign bodies into the rectum. Trouble may also arise through swallowing bone fragments and other things that perforate or tear the tissues. If a foreign body is present in the rectum, this is not uncommon in children. The rectal area should be thoroughly cleansed with soap and water and the foreign body carefully removed. Great care must be taken to avoid further damage to the tissues. All severe cases of this type are best treated in hospital. Rectal stricture or narrowing of the anorectal canal often follows injuries to the rectum. It may also follow surgery for hemorrhoids and other rectal problems. A rectal stricture is a distressing condition that usually results in constipation and gaseous distension. Try to keep the stools soft, as suggested on page 358. Take plenty of fluids, and avoid too much roughage in the diet. Corrective surgery may be the only solution to this problem. Bowel incontinence, lack of voluntary control or bowel movements in another distressing condition that sometimes follows an injury to the anal area. It also occurs in elderly people who have lost control owing to a stroke or other vascular injury. Proper bowel training may enable the individual to control his movements fairly well and to avoid trouble after having the first movement in the morning. Corrective surgery is possible in some cases. This should be done by a good general surgeon or a rectal specialist. Rectal itching. Itching is more common around the rectum than in any other part of the body. The trouble may be due to allergic conditions, irritating soaps, tight clothing, the use of antibiotics by mouth, or the presence of pinworms and other parasites. Local rectal conditions such as hemorrhoids may be responsible. Female genital disorders often extend to the rectal area. Fungus infections, trichomonas, and F24. 360 rectal troubles. Various skin parasites must also be considered. Patients with jaundice, uremia, or diabetes often suffer from intense itching, which only disappears when the underlying condition is brought under control. Often the itching is worse at night and may be aggravated by heat and scratching. Soon the skin is red and there are scratch marks with moist, oozing areas, later followed by a whitish-gray appearance. Fungus infections are particularly irritating, especially if allergic factors are complicating the condition. Treatment: keep the skin clean and dry and free from irritation as far as possible. After a bowel movement, clean the anal area by patting with moistened, soft, toilet tissue. Avoid the use of harsh soaps and other strong detergents for the present. If broad-spectrum antibiotics such as terramycin have been used, these should be discontinued. Avoid the use of greasy and oily preparations. Dusting the irritated area with corn flour or applying calamine lotion several times a day may help to relieve the itching. Sitz baths and cold compresses used several times a day will also help. Hydrocortisone cream or prednisolone ointment are highly effective and may be applied once or twice daily. An aspirin tablet taken every 3 hours and at bedtime may help to reduce the irritation and allow the skin heal.